Welcome to this podcast. The focus question: what are the priority issues for improving Australia's health? In this podcast, we will look at high levels of preventable chronic disease, injury, and mental health problems. The focus for this podcast will be on cardiovascular disease. At the end of this podcast, you should be able to research and analyse cardiovascular disease by investigating the nature of the problem, the extent of the problem or its trends, risk factors and protective factors, the sociocultural, socioeconomic and environmental determinants, and the groups at risk. The nature of cardiovascular disease. Cardiovascular disease, or CVD, includes all the diseases of the heart and circulatory system. Most result from a damaged blood supply to the heart, coronary heart disease, and the brain, cerebrovascular disease. Cardiovascular disease is most evident as stroke, heart attack, angina, and peripheral vascular disease. The damaged or blocked blood supply is caused by either atherosclerosis or arteriosclerosis. Atherosclerosis is the build-up of fatty and/or fibrous material known as atheroma on the interior walls of the arteries, which hinders blood supply and increases blood pressure. The build-up of atheroma decreases elasticity and limits blood flow. It is the underlying cause of heart attacks. High blood pressure, smoking, and a diet rich in saturated fat increases the risk. Arteriosclerosis is the hardening of the arteries, whereby artery walls lose their elasticity. To some extent, it is a part of the aging process. It is a form of atherosclerosis. Coronary heart disease, or CHD, is also known as ischemic heart disease and occurs when there is a blockage in the heart's own blood supply vessels, the coronary arteries, that supply blood to the heart muscle. This is normally caused by atherosclerosis. There are two major clinical forms of coronary heart disease. The first is heart attack, often known as an acute myocardial infarction, an acute life-threatening event where the blood vessel is completely blocked, requiring prompt treatment. And the second major clinical form is angina. Angina is a short episode of chest pain that occurs when the heart has a temporary deficiency in its blood supply due to severe but incomplete blockage in one of its arteries. Although angina is less severe than a heart attack, people with the condition are at an increased risk of heart attack or sudden cardiac death. Coronary heart disease kills more people in Australia than any other disease. However, it is largely preventable, as many of its risk factors are modifiable, including tobacco smoking, high blood pressure, high blood cholesterol, physical inactivity, poor nutrition, and obesity. Stroke is also known as cerebrovascular disease and can occur in a similar fashion to a heart attack and is the result of either a clot or atherosclerosis, which limits blood supply, or may be caused by an aneurysm. An aneurysm occurs when high blood pressure damages and ruptures blood vessels in the brain, which then bleed into the cranium and may lead to the death of some brain tissue due to a lack of oxygen. Peripheral vascular disease is a disease of the arteries, arterioles, and capillaries which affects the limbs, usually reducing blood supply. Peripheral vascular disease accounts for more deaths in women than men and is the underlying cause of both stroke and ischemic heart disease. The extent of the problem. For the latest trend data, please refer to the supplementary handout from the latest edition of the Australian Institute of Health and Welfare's biannual publication, Australia's Health. Remember, you do not need to know the latest statistics on the rates of illness and deaths. It is only important to understand whether the prevalence of leading causes is on the increase, decrease, or are stable. Risk factors. The major risk factors for developing cardiovascular disease include some that can be controlled or modified, and some which cannot. These non-modifiable risk factors include a family history of the disease, gender, and advancing age. Major risk factors that can reduce or be eliminated by lifestyle changes or medical treatment are modifiable risk factors, and these modifiable risk factors include smoking, raised blood fat levels, high blood pressure, obesity and overweight conditions, abdominal obesity, and physical inactivity. Other factors include diabetes, which causes damage to blood vessels and contributes to atherosclerosis as a result. The contraceptive pill, which obviously applies to women and particularly women who smoke, are 35 years of age or over, have high blood pressure, diabetes, and a family history of cardiovascular disease. And alcohol consumption. Alcohol consumption contributes to excessive weight and stress, which also increase the risk by indirectly affecting these other factors. Protective factors. As you can see, there is an extensive list of protective factors. Note that in many cases they are a corollary of the respective risk factor. For example, while physical inactivity is a risk factor, simply becoming physically active may reduce the risk of coronary heart disease, stroke, and peripheral vascular disease. In addition, premenopausal women have protective hormones, that is estrogen and progesterone, which seem to decrease the risk. However, a woman's risk increases after menopause. Protective factors include regular physical activity, diets low in saturated fat and cholesterol, a reduced consumption of alcohol, diets low in salt, maintaining a healthy weight and managing stress, avoiding exposure to tobacco smoke, and monitoring blood pressure and blood cholesterol levels. Social determinants, or socially based causal factors, are factors which affect the health outcomes of an individual. They are a complex interplay of various causes and affect the health behaviours of individuals. These factors, that is, the sociocultural, the socioeconomic, and environmental determinants, combine with individual knowledge and various biomedical factors, a combination of genetic, lifestyle, and other broad factors such as impaired glucose intolerance, to influence health outcomes. Sociocultural determinants. Sociocultural determinants include family history. People with a family history of CVD are more at risk. People from Asian backgrounds are less prone to getting CVD, generally due to a low-fat diet. Aboriginal and Torres Strait Islander peoples are more at risk as they are associated with having lower socioeconomic status and lower education levels. And media exposure. Media exposure affects smoking on health and have led to a reduction in smoking rates and therefore a declining trend for CVD rates. Gender is also a sociocultural determinant in that higher rates can be found in males, which can be attributed to males being more likely to ignore health warnings and less likely to access health services. This may be due to social constructions around masculinity. Socioeconomic determinants. People with a low socioeconomic status or who are unemployed have higher death rates because income can limit health choices, such as purchasing fresh fruit and vegetables and using exercise facilities. People with low education levels are more at risk as poor education is linked to poor health choices and less knowledge about how to access and use health services. Reduction of death due to CVD has not been significant in people of low socioeconomic status. Also, these people are more likely to be involved in risk-taking behaviours such as smoking, obesity, and physical inactivity. Environmental determinants. People living in rural and remote areas are more at risk. They tend to have less access to health information, health services and technology, such as ECGs, for example. Indigenous Australians who live in rural locations are also more likely to consult with elders than use local health services. A lower consumption of health services can be traced back to a lack of access to these particular services, particularly in rural and remote locations. The groups at risk. Aboriginal and Torres Strait Islander people have death rates that are 2.4 to 2.6 higher than the non-Indigenous population. People who are socioeconomically disadvantaged tend to have death rates that are approximately 1.4 times higher. And people born inside and outside of Australia also have a particular risk. People living in rural and remote locations are also at an increased risk for some cardiovascular diseases. People born overseas tend to have protective factors. In Australia, we tend to screen our migrants very, very carefully and tend to only allow those with healthy bodies to enter the country. This is known as the positive migrant effect. However, over time, as these people adopt a more Western diet, this positive migrant effect starts to decrease, and they are just as much at a risk as those who were born in Australia. Within these broad groups are people at particular risk. These people include those who are aged 65 years or older, tobacco smokers, people with a history of cardiovascular disease, people with hypertension, people who consume a high-fat diet, people who are physically inactive, males, and blue-collar workers. These are labourers and tradespeople who may have high levels of smoking, alcohol consumption, and have high-fat diets. Now it's over to you. Your job is to answer the question in approximately 800 words to justify why cardiovascular disease has been identified as a health priority area in Australia. Thank you for watching this podcast.